Spirituality in patient care, very important area. For me, my experience is, it goes back probably to the early 70s, where I was still doing hospital nursing. And I remember working in a Jewish hospital. I'm Roman Catholic. And back in those days, nurses did PM care. We would go in and we would rub backs. We would ask if the person was comfortable. We would really kind of tuck them in, if you will. And part of my routine was I would always say to people, when I leave you, I'm going to be praying for you. Is there anything specific that you would want me to pray for? Now remember, I'm in a Jewish hospital. I'm not in a Catholic hospital. And so many of the patients, I remember them grasping my hand and saying, when you're walking down the hall, I'm having surgery tomorrow, please pray that I get through it. Pray that the doctor knows what he's doing. Pray that all the people in the OR are really paying attention to me. Or there might be another one that I left home today and I was angry with one of my children. Please pray for reconciliation. It's burdening me and I'm not well and I don't want that burden. I pray that I'm asking you to pray that I'm able to make amends with that child. I was amazed at that because nobody turned me down. There wasn't one person who said, oh no, don't bother me with that, or no, there's no need. People always gave me a reason to pray and a specific item that I was to pray for, an issue that I was to pray for. And many times if I came back and they were still there, I'd get feedback. Oh, you know what? I slept so much better last night. You did pray for me, didn't you? And I say, absolutely. Do you need more prayer tonight? And whatever they asked for, then I would do. Once in a while, back in those early days, I remember one lady grasping my hand, and remember, she's Jewish, I'm Christian. She grasped my hand and she said, honey, please pray with me right now. And so I just prayed to God. I didn't pray to Jesus. I made my prayer something that wouldn't make her feel uneasy inside. I said, dear God, watch over this lady and whatever it was that she wanted me to pray for. I really can't remember anymore, but I prayed in a way that she would be at ease with. And at the end, she said, amen. So I really believe that it's a gift we offer people. And it should be much more a part of the healthcare system. We're not the healers. Our skills really come from God, but ultimately healing comes from God. And so God uses us as ministers to make people feel better, to feel confident, to help them live a better lifestyle, to prepare them for surgery, to prepare them for death. All of those issues that we're involved in have a deep spiritual component. We may be the ones who need to raise that issue. Believe me, it's not proselytizing. You're not trying to convert somebody to your religious faith. What you're saying is, we all are spiritual beings. How can I support your spirituality right now as you go through this? Maybe it's trauma, worry, concern, surgery, whatever it is that the person's carrying that's heaviest in their heart. We can really be instrumental in giving something that may be more effective than the most powerful medication we have.